Do you know Botox was first FDA approved in 1989, and since then about 11 million people have gotten injected with Botox. It is also the most widely done or the top non-surgical cosmetic treatment done worldwide. The second being a hyaluronic acid containing filler, and the third being a laser hair reduction. Hi, I'm Dr. Radhika Kopikar. Welcome back to my channel. And in this video, we will be discussing some of the frequently asked questions regarding Botox and fillers. Stay tuned till the end of this video for some exciting offers on Botox and fillers if you plan to come to Kopikar Dermatology for that. So there are actually a lot of myths surrounding Botox and fillers. The most common ones being that the face will become frozen when you will not be able to express yourself or the expressions will go away. The second most common one is that the lips will become big like a Donald Duck or the cheekbones will become too artificially high. So this is because that the media highlights such cases or personalities who have gotten too much of it done. But that's not actually how we do it in a clinical setting for regular people. Well, the idea behind doing Botox and fillers is to give you an enhanced and a refreshed look and keeping your unique features intact. So people will notice that you look great, but they will never know that you've done any cosmetic treatment to enhance yourself. So that's the whole idea. And these myths, I think it's high time that we do away with it, because if we underdose or keep the doses in the normal limits, it's very hard to go wrong, provided you go to a trained and a experienced injector. So, you know why Botox was actually invented? It was invented for blepharospasm and strabismus, which are actually eye conditions. So, when doctors or ophthalmologists were using it for those medical purposes, they realized that the frown, the lines, the crow's feet, or the lines around the eyes, they improved. So that's how Botox as a cosmetic treatment was born. It has multiple medical usages, like for hyperhidrosis or for people who have excessive sweating. Botox is used. Botox is also used for torticollis or stiff neck. It is also used for migraines. So it is not just used for cosmetic purposes, but it has a lot of other medical usage. So fearing it is absolutely wrong. It is used in very minute doses on the face because the muscles here are very small, in contrast to the bigger muscles or the migraine muscles that we use it for. So the dosing on the face is extremely minute. So I think you all should know that it is not just a cosmetic treatment, but also a medical one. I understand all of that, but I do get a lot of patients who sometimes are quite insecure or lack self-confidence or self-esteem due to the changes in their looks. Not just aging, but certain accidental scars or autoimmune conditions can also disfigure your faces. And there, where Botox and fillers can act as a great tool to improve your own level of self-confidence and performance, personality, I think there's nothing wrong in that. So enhancing your own looks, making it uniquely you and keeping your own features alive and preserved for a long time can be done safely with the use of these treatments, which are medically acclaimed, done all over the world, and US FDA approved for its safety and efficacy. So not at all. Botox can add contours to your face. It can add volume to where it is lost. It can help in lifting of the skin. And when done in the correct way, in the correct dosage, at the correct points, you will look as much natural and pure as you are right now. So it will not change the structure of your face or the looks that you are naturally born with. It will just enhance it and make it more uniquely you. That's what I always say, that we don't want to change the way you look. We just want to enhance it and add a little bit of touch here and there to make you look even more beautiful than what you perceive yourself to be. So Botox or botulinum toxin normally lasts for 4 to 6 months if done in a proper dose. If done in a minute dose, which is called a baby Botox, it lasts for about 2 to 3 months. So Botox, as you understand, the effect reverses or comes back to how you were after a gap of 4 to 6 months. After that, it's totally up to you. If you would like to maintain that appearance and look, you can repeat it. And if you don't want to continue with that, then you will just come back to how you naturally appear. So it's not a must to maintain it. It's a totally subject to your choice. On the contrary, fillers last for about 6 months to up to 1.5 to 2 years, depending on the quality of the filler or the thickness, the G prime, or the rheology of the product that is used. So, different fillers last for different amounts of time, from a range of 6 months to up to 2 years. And then after that, you will slowly return to where you started from. After the effect wears off, it's again your choice and up to you completely whether you want to repeat it or not. If you don't, nothing changes. You just come back to where you started from. And if you do, you continue to look the same way how you did with the filler. So addiction is such a word. It's not a good word to use, I think. But there are certain people who like to look at them, how they appear after doing a Botox and filler. So if you enjoy that appearance and look on your face and you want to maintain it, you can repeat and keep doing it for a long time. There is no harm. But if you're somebody who's doing it for an occasion like a wedding, or you're doing it for a movie or for a appearance or for a role, then it's totally your choice whether you want to repeat or do it in a different way the next time. So addiction is not the right word to use here, but of course, if you like how you look after these treatments, then you can continue doing it for the long term without any major side effects. So pregnancy is a very crucial time in any female's life, and we do not want to tamper with that. So just because of the lack of studies done in pregnant females stating that it is safe in pregnancy, because studies have not been done in that group of people who are pregnant, we just try to stay away and not do it in pregnant females or lactating females. So if you are planning pregnancy, are pregnant, or breastfeeding, I would suggest don't plan to do a Botox or a filler. You can always do it later on, and that's about it. The ideal person to do your Botox, botulinum toxin, or a filler should be a dermatologist or a plastic surgeon, merely because they are extremely well trained and understand the skin anatomy, the structures, and the bony structure, the vasculature, everything that's there within the skin. So these two fields of medicine are truly deeply trained in your facial skin anatomy, vasculature, bony structures. So they are the best people to go for cosmetic treatments. There is no right time to start. It's as you feel. Anybody who's above the age of 16 years of age can start doing it, uh, whether it's for their occupation or their career, for certain other reasons. As I said, it's not only done for cosmetic purposes, it's also done for autoimmune conditions or accidental cases. So there is no right or wrong here. You can start anytime after the age of 16. And in certain conditions, it is even done at an earlier stage, as I said, for medical purposes. So beauty, according to me, is an amalgamation of a lot of factors. It's multifactorial. It is completely unique, very, very subjective. And it is not only about the looks, but it also encompasses your culture and overall personality. So that is what beauty is. And you don't need to ape anybody. You can be beautiful just the way you are. So yes, you can immediately go back to your normal routine. It's called a lunchtime procedure. So patients walk in, get it done within a few minutes or half an hour's time, and then go back to their normal routines. There is no restriction. There are certain post procedure instructions that we will give you, but in no way you have to sit at home or restrict yourself from working. After the procedure, you can go ahead and continue your regular routine. There are three main pointers which will determine the cost of your botulinum toxin and filler injections. One is the brand of the product that is used. Second is the doctor who's injecting, how experienced the doctor is, how well trained the doctor is. And third is the location of the clinic where you attend. So these are the three main reasons which will determine the cost of your treatment. And this is best that you discuss it with your doctor, because the dose, the product used, the amount required, all of these will also determine how much the procedure will cost you. So here we are at the end of this video, and this is the part where I promised you the exciting offer. If you come into the clinic and tell us the code BFKD10, we will be offering you 10% discount on these treatments. So don't miss the chance, and take care till we meet again.